Your Excellencies, ladies and gentlemen, I greet you not just as the First Lady of Sierra Leone, but as the proud President of the Organization of African First Ladies for Development, OAFLAD. I regret that I cannot join you in person today at the World Health Assembly in Geneva, but I am honored to open this meeting marking 5 years of the World Health Organization Global Breast Cancer Initiative. This milestone is not only about counting years, it is about counting lives saved, and it is a sobering reminder that far too many women, especially in Africa, are still dying from a disease that, when detected early and treated effectively, should not be a death sentence. Let me speak first about my own country in Sierra Leone. Our health system has come a long way, but like many countries, we still struggle with limited screening facilities, too few oncologists, late diagnosis, and the deep-seated fear and stigma that surrounds cancer. Too many women are diagnosed only at advanced stages. Too many mothers, sisters, daughters leave their families too soon. That is why in Sierra Leone, we have been working to strengthen community health outreach, train frontline nurses in breast cancer awareness, and break the silence around women's cancer. We are small in resources, but we are mightier in resolve. And we are learning that when a First Lady visits a screening clinic, when she sits with survivors, when she speaks openly, women listen, policymakers act, communities mobilize, and lives are saved. But Sierra Leone cannot do this alone. No country can. That is why OAFLAD is such an important platform with more than 40 First Ladies across Africa. We have used our voices to challenge stigma, mobilize political commitments, and elevate women's health onto national budgets, continental agendas, and global platforms. Across so many country initiatives, OAFLAD is the thread that connects us. And today, I am also proud to announce that under my leadership, OAFLAD has officially launched a powerful new vehicle to advance this effect even further. A network that brings First Ladies together around the noble cause. We are calling it the Together With Her Network. What is Together With Her? It is a multi-stakeholder platform that brings together First Ladies, ministers, technical experts, civil societies, survivors, development partners, and the private sector, not just to talk about challenges, but to deliver solutions. It is how we ensure that every OAFLAD commitment translates into screening machines in rural clinics, trained nurses in remote districts, and stronger referrals and treatment pathways that do not end at a closed door. Together With Her recognize a simple but powerful truth. No woman should face cancer alone, and no First Lady should champion this fight without a network of solidarity and partnership behind her. So as we reflect on 5 years of the Global Breast Cancer Initiative, let me be clear. Progress has been made, but acceleration is urgent. We need your support to bring this network to life in practice. We need domestic financing. We need integrated primary health care. We need universal health coverage that include affordable, responsive, and equitable cancer services. And we need the Together With Her network to become the backbone of that acceleration. From Sierra Leone to Kenya, from Egypt to Botswana, and across the continent, reaching beyond OAFLAD's membership, because every woman's lives matter, whether she comes from my country or another. To our partners in this room and beyond, work with us, invest in us, believe in the power of African women, leading African solution. Together With Her, we will save lives. I thank you for your kind attention.